This episode, I'm chatting with Megan Gilmour. Megan is the CEO of Missing School, a not-for-profit organisation dedicated to raising awareness of the education and social needs of children who miss school due to serious illness, injury or complex health concerns.
Child-to-child time without adults being around, it's certainly not having needles put in you. It's the freedom to be normal and all the things good and perhaps challenging sometimes at school, but challenging in a positive way that helps these people, these young people, become members of society, become part of a community, to understand how to be human.
Before we begin, we would like to acknowledge the traditional owners of the lands on which we record. Today, we are recording on country of the Kaurna people of the Adelaide Plains. We pay our respects to elders past and present who are part of the world's oldest continuing culture and our first storytellers. We acknowledge the importance of supporting health for all peoples, now and in the future. Very warm welcome to you, Megan. Where are you joining us from?
Hi, Sami. So pleased to be here. I'm joining you from the capital city, Canberra.
Oh, wonderful. Lovely ACT. Excellent. So, Megan, I'm super curious to chat to you tonight. I'm really looking forward to it because this is new to me and I'm sure new to a lot of listeners, but incredibly beneficial. So I'm excited to hear more. So can you tell us about Missing School and how you help children in realistically a really vulnerable part of their time if they've got complex health or had a severe injury and they're missing school? So how did this organisation come about?
Well, Sami, Missing School started officially in 2012, 3 mums in a Canberra lounge room. We'd all had sons with very serious medical conditions that kept them in hospital for a long time, kept them at home for a long time. And what we noticed, in our sharing as mothers do at this time, this critical time, is just what these kids go through. I'll just put it like that and we'll probably come into that a bit later. But through that, how much they miss school. So not just physically missing school, but how much they long to be in their community, how much they long to be with their friends and to be normal and to be able to play and do what kids do and have those, learning opportunities, because kids are learning all the time, right? Not just at school, but to be, in their environment with their curiosity and their brains being stimulated. And this seemed to us, while we had all this amazing medical support and, incredible healthcare, that was an unaddressed part of their journey. And so we got together, we looked for information on, how many kids are affected across Australia, how much school do they miss, what is out there to help them, and whose job is it? And we couldn't really find any answers. And I guess it, really was pushed along by my son's journey, Darcy. He was sort of the last boy through of the 3. And it came about for me personally in my personal struggle of seeing Darcy, after fighting so hard in his complex medical situation, starting to lose hope. And I really thought that I hadn't done enough to keep him connected. And I wanted to show him that, he had a life worth living and there was school waiting for him when he recovered. And that's where, all these sort of questions started arising. And I found that the school, despite having done, some amazing things for our family as support, this educational part, this continuity of education part and social connection was the missing link. And it is for so many families even today.
Wow. So that's how Missing Schools was born. I love that you said 3 mums in the ACT in a lounge room sharing.
Yeah.
So beautiful. And realistically, if we talk about a lot of these wonderful organisations that bridge these gaps, it is, isn't it? It's from us all just chatting and sharing about our lived experience and understanding, hang on a minute, nothing's being done, so why don't we get together and do something? So that's wonderful that you've bridged that gap, and thank you for sharing and introducing us to Darcy. So obviously in our audience is very familiar with your journey as well. A majority of the people listening are heart parents or they're adults now, heart teens. So we know that in our community of COHC, there's a significant impact on children that have repeated hospitalisation, surgeries. the recovery period. And I think the thing that we also to understand, and we've spoken about it before, and I'm not sure if it's the case with Darcy, but it's also to the lead up. So a lot of our kids have low immune or immune compromise. So it's not just about leading up to a surgery. It's about actually keeping them healthy before a surgery or after or during. So like you said, it's that education piece. But like you said, they're missing out on those really critical moments. So can you talk me through what are the numbers we're talking? I know how many are in our community, HeartKids. But as you said, this is right across Australia, kids with complex health.
Yeah, well, it's a great question, Sami, and it's a big question. And unfortunately, it's an unanswered question from a government point of view. So in our 2015 report, which was one of the first sort of major pieces of work Missing School did, we asked this exact question, and we commissioned ARACI, the Australian Research Alliance for Children and Youth, to develop this report, and we ended up being co-authors to the report. Let's just say we had to extrapolate to try and get a number of how many kids are chronically absent from school due to a serious health situation. And there are just no numbers. It's not tracked in Australia in a way that we can sort of quantify it. But we do know from peer-reviewed research that up to 30% of students, or kids rather, experience a chronic illness serious enough to affect their education and attendance at school. And so if we translate that into the school population in Australia, that's the K-12 school population, we're looking at about 1.2 million students who could be missing chronic amounts of school. Now, we do say, wow, like I
that's
said, wow,
big number.
That's a lot. That is a big number.
It's a big number.
And, people sort of say, is that true though? And I mean, I would really love to have this conversation with government on a platform, on a panel, whatever, and just sort of say what I've said to you, which is we don't know. But if we look at how much school absence is problematic, the evidence shows that, anything more than 10% of school absence, either cumulatively or in a block, is problematic for education and educational outcomes. To translate that, that's 5 days a term or 10 days a semester.
Yeah, okay, yeah.
So it's not a lot.
No, and when you start talking about complex health and level, that sounds kind of normal in our world, doesn't it? It sounds kind of normal that very, depending on what your child is going through, not uncommon to have a week or 2 weeks or a month off or whatever else. So we've talked obviously a little bit about Missing Schools is there trying to sort of bridge that gap from an education. But I'd love to express more, Megan, about what you said just earlier about looking at your son and seeing that he started to lose hope. And I'm sure from one mum to another mum, what you're really recognising is that little sparkle in their eye that they need to be around their peers. They need to be around all those silly interactions that they have, but they're not silly, they're developmental. Because us as adults, we did it. And so when they're constantly around medical professionals or therapists or whatever else, and us as adults, they don't get that really beautiful play, do they? That's peer
right.
play, yeah.
Yeah. So, I mean, we can preface all that by saying, and, this is not to gaslight an audience, but it's just to say those of us who have had that lived experience that you refer to actually bear witness not just to our own child's journey, but all the children who we come across in a hospital setting.
Indeed, indeed.
And these kids do it tough, and they're amazing. Their resilience, their fortitude, their willingness to do things they don't want to do is really something to behold. And so owe it to them to give them what they're working for, which is, that connection to childhood. And as you covered it, I mean, let's talk about those things. It's play. It's about child-to-child time without adults being around. It's certainly not having needles put in you. It's the freedom to be normal and all the things, good and perhaps challenging sometimes at school, but challenging in a positive way that helps these people, these young people, become members of society, become part of a community, to understand how to be human at the heart of that is social connection. And we all know there's been a universal experience of what social isolation is like.
Haven't we just? Yeah.
And how many parents in this situation where they have a child who has, a serious medical situation or context said, oh, gee, now people might understand some of what these kids go through, being isolated, being, recuperating at home, sometimes for long periods of time, depending on what their illness is. So we know that the social connection is critical. And that social connection is about peers. It's also about other adults. It's about interacting with teachers or the person at the front desk or people who come into the school to do presentations. It's about assemblies. It's about going to library. It's about an excursion. So there are so many things that school means that is beyond the academics. But let's also recognise that continual breaks in educational, continuity, those breaks do cause academic struggles for many children in these circumstances. Research from Australia, in fact, shows that children with chronic illnesses or chronic medical conditions are 3 times more likely to fall behind their peers in key subject areas. And so, as well as their own medical health journey, they're also now up against trying to catch up.
Socially.
Not just academically, but also socially.
Socially and emotionally. And if I can throw something else into this, like you just said, I think school, sometimes you think of the term school, and I think the first thing you think about is sitting in a class and learning in textbooks, and obviously they don't do textbooks anymore. Showing my age, sorry. But, they've got their, what are they, magic boards now or whatever else, and their iPads and everything, that this is how they're learning. But like you said, I loved how you touched on the fact that from that social side of things, because if we think about it, there is a big portion of school that's academic-led, but there's a lot of, like you said, research and data now saying that promoting learning through play and promoting that social and emotional connection for the child and then layering the academics on top as opposed to the reverse. And, I remember speaking to a child psychologist many years ago, and she said every child has a job. And I thought, okay, where's she going with this? And she said their job is to play. Their job is to play. It's that push and pull, and like you said, that understanding. So on that, Megan, if we were talking about the impact of missing school for anyone in any of this educational time, like you said, K to 12, is there an okay or a satisfactory amount of days that research or data tells us is okay for a child to miss, or a safe number of days?
This is to quote the research. There is no safe threshold for absence.
Wow. Okay.
I think this is we're getting to the heart of the matter. And, this is why Missing School is working so hard for educational and social and emotional connection to school, to the student's own school. So many people will say, oh, it's fine, we'll just do tutoring, and not every family can afford tutoring, and
that's correct.
Everybody is in that position. And
Absolutely.
You would know yourself the financial duress that families are often under in these circumstances. One parent not working,
Absolutely.
Parents separated from their family home to travel for treatment, all that is entailed in that.
Yeah, and the social and emotional impact on the parents too.
That's right.
Isolation
and so parents are trying to, let's just put a placeholder right here for siblings, and we can come back to that. But it's a very, very big time. So we Missing School, and we recognise that, often the case, well, I don't know if often's the right phrase, but it could be the case that children aren't comfortable in their regular school. And there's a lot of that emerging now with the rise and recognition of school refusal. And that's a kind of another area we probably won't go off into too much detail about, but unless you want to. But I guess what Missing School is promoting is that we're really working to get that young person back to their regular life, back to their school. And so even if they had tutoring, that's not the same as learning with your learning community and your peers. And so what we do know about school isolation, missing school often or for long periods, is that it can create social anxiety. It can create anxiety about going back to school, which makes sense. A lot of people, adults, post-pandemic, conveyed that they've experienced social anxiety when returning to public settings and situations. So there's something very human that's sitting right there. And so when we can maintain continuity to the young person's place, it means that we're reducing that anxiety about being absent and coming in and out, which, can happen for treatment and convalescing and things. So that's the bridge that we're really trying to.
Yeah. It's great to hear you unpack it in so many ways too. Like you're obviously talking about, obviously you've got your lived experience, you're seeing other things, you then have, you've tried to find more data and research of what is actually going on out there. And that's great considering that you guys only started in 2012 to then already have your really big piece of work in 2015 and trying to actually grapple with what does that number actually look like. So now take me to the practical side of it. What do you do? Like, how does Missing Schools provide that direct support?
Yeah. So what we set out to do was to demonstrate, I can say that we have done this. So all the way along, but by 2017, we had achieved the funding that we wanted to achieve to pilot a national telepresence robot service, which would place this telepresence technology into the schools of children who couldn't be there because of their medical situation. Here we're talking medical and mental health situations.
Sure.
And injury. And the premise of that was that there's no proxy for presence. You have to be there. You can't have a go-between to come back and tell you what was said and go back and tell them what was said, and we're living in this age where we have technology, and to show that when we can create a two-way digital connection for that student straight back into their own classroom or classrooms, then our belief was that other positive things would happen beyond that connection, which of course was, intended to give that student social connection, to overcome loneliness and isolation, to connect them to their teacher and curriculum, that social learning, the emotional, some play. But what we also wanted to show is that when a student is present in the classroom, even digitally, that activates what a school does. It's not the illness. Yes, that does cause a disruption and it causes the absence. It's not even the absence. It's the fact that that child is not able to be present in the classroom. So when you can connect them virtually, what we see is teachers doing what teachers do, peers doing what peers do, school support systems doing what school support systems do. But something happens when you're not physically there.
Yes, yeah.
Schools aren't designed for students who are not in the classroom, but we're working to change that. That's our next big mission.
That's great. And I love that you touched on robots. So what does the technology, what does it actually look like? And as soon as you say robots, I don't know, for me, the fact that you say that, I'm sure you have kids that hear that and go, oh my gosh, yes. Yes.
Yes, we do.
Yes. Do I have my own robot? So, because like you said, I love the fact that then I could imagine as soon as you say to a child, you're going to be a robot in that class or whatever else, you're going to see your teacher walking around, you're going to see little Johnny, over here doing his usual stuff and whatever else. So I'm sure that even just conjures up, it probably sparks something in them just knowing that there's a way in which they can sort of interact. So what does that look like and how is that different? Because obviously a lot of us listening and, we've all lived through the pandemic. We know Zoom, we know Teams, we know Google Meet, we know all of that. We've seen it all now. But what does this robot look like?
Okay, so imagine an iPad on a stick with like a Segway with a base and wheels.
Oh,
and then,
brilliant.
And a speaker system built into it. So the key difference between the telepresence robot and, say, Zoom or Teams or Google Meet is that the child, the young person who's not in the classroom, who's dialing in through their robot, can actually move that device around as if they're in the room.
That is phenomenal. I'm excited.
It is indeed.
And I'm so excited that we're chatting about this. I'm so excited that more people are hearing about this.
Yeah. Well, you can imagine we're going back now to 2017, mid-2017 when we started that. And I was working on that for 2 years leading up to that. So, this was really novel. This was really
cutting edge.
It was really innovative, to be able to use your laptop or a phone or a tablet from hospital or home click a button and be on a screen in your classroom, which could be in a whole different state. Like we've had kids who were in Victoria, in the Royal Children's Hospital there, but they lived in New South Wales and their school was in New South Wales, and,
Really,
and then to
really
be able
common.
to dial in.
Yeah, because as you know, we go to the best medical care, don't we?
Well, this is right.
That could be anywhere.
Interstate travel, we've had families, whole families, moving interstate for treatment. So, this is also something that people who don't have a lived experience, might not appreciate as well. But this student is, from wherever they are, is now in their classroom being seen and heard, seeing and hearing, meeting with their peers.
And responding too. Seeing, hearing and respond. Yeah.
And being able to move. So they have agency, they have control over their movement, which really is different to Zoom. And they also can see a very immersive kind of view of the room rather than a room like a square that we're seeing. They can see more like a fishbowl situation. Of course, they can also turn it to look if they hear a sound as well and look up and down with the robots that we use. This was our contribution, and we've collected over 5,000 data points now on the use of telepresence robots in schools across Australia, every state and territory, every school grade, every education system type, public sector, independent schools, faith-based.
Amazing.
So it's been a lot of learning. And, the main things that this type of connection, the main benefits are found in reducing anxiety, increasing opportunities for learning, and that big one of getting the school activated, like increasing school support as well, because they're there. They're physically represented by the robot.
And I think that, like you said, it's that physical representation. You can't deny or ignore that. Does that make sense?
That's right. And that was exactly the reason we chose robots, because Zoom already existed then.
Yes.
Laptops in schools, as you said, they were already there. So why weren't they being used, and why aren't they being used now? So this is the way that we've evolved through this, Sami, is now, we realised very soon that no charity, no one education system, in fact, can provide robots to every school that needs them, which, as our data shows, there's multiple students in every school who are in these circumstances.
Sure.
So let's say every school. To do this at scale, it really needs to be each school. That's the only way that it can scale. And so the pandemic, if there was a gift for us from the pandemic, was to demonstrate this can happen at scale. It's expected to happen when a child can't go to school due to a health crisis. COVID is a public one. HeartKid is a personal one. But there was an expectation, right? Nobody said, we should just forget the kids. We don't need to connect them to school. And so, we've seen that now. And so what we want to see is schools following workplaces into the 21st century with learn from anywhere flexibility for these kids. Yeah, it makes sense, right?
Absolutely, Megan. And I think I remember in my professional career chatting with a client once that had satellite staff and places, and she was saying she was struggling to get everyone into the office for staff meetings and so forth and professional development. It's funny, like you said, even pre-COVID, I was saying, well, there's this thing called Zoom. And basically they can download it on their phone. So even if they're in the car, they could hop in their car before they drive and, blah, blah, blah. And it was really funny. She always used to look at me, like I was a little strange. And then COVID hit and wham, boom, everybody, here we are. So, but I love the fact that you've seen this challenge, you've seen this problem, you've come up with a solution. And realistically, you've made a hybrid, haven't you, of stuff that's already existing. And that's where our best disruption comes from in life, isn't it? You actually use existing products, but you just use them in a different way. So it's all incredibly exciting. I'm excited. I'm sure there's so many parents going, oh my gosh, because there's a big group of us in our community in HeartKids that it's early on in the journey. And so we've done episodes around, going to school or going to childcare and what does that look like and all those sorts of things because of the health condition. We're immune compromised or whatever else and we want to take the best care we can, but we also understand that it's so important that our children don't miss out on that play and interaction. So it's great to know, though, that there are different stages of our journey, and there are still a lot of people who have open heart surgery or procedures, especially in our community, in those formative years, whether it be, when they're a teen or whatever it is. So it's great to know that there's something actually out there. So now I want to know, how do we get involved? Tell me right now, I'm a parent and, my son or daughter is about to have open heart surgery. They're missing school now for a couple of weeks because we've got to make sure that we keep them lovely and healthy. What do I do? Do I contact you? Do I contact the school? What do I do?
You can jump on our website, or parents can contact our helpline. So our helpline number is 1300 237 234, and we're at missingschool.org.au. And so there's school links on our site, so information for schools, information for families, and there's research, and there's all sorts of other helpful things as well that people might find useful, noting what you've said about different stages of the journey.
I'm just going to jump in and let the audience know that these will be in our show notes. So if you were trying to quickly scramble and write down that number or website, just understand it will be in our show notes. So sorry, do continue, Megan.
Yeah, so the way that we're heading now is we're working at a national level to try and get schools to activate their own technology. So who knows what this could look like, right? So it could be big screens up and children who aren't there due to, who can't physically attend for legitimate reasons might be able to dial in to those and be seen in their classroom. There's all sorts of ways that this can happen. So whilst we've provided robots and still do now, and we're open for business on that, what we're really trying to achieve is, in cases where schools might not accept a robot, is to help families to have that conversation with their school, to help schools to understand, we can go into this a little bit more, that child's journey through their specific aspects of their journey so that they're safe at school, and also so teachers have some basic information on the particular health issue they might be facing, but also so that schools know what the national regulations are in terms of this. So
okay,
it's worth just saying that here right now. And some parents don't know this, and some parents feel like it's their responsibility and there's just not awareness about it. But the Disability Standards for Education covers all sorts of health situations. It's very specific. It's not exclusive. It's quite wide-ranging. And what the standards expect schools to do is to continue to provide access for students to the school, continue to provide access to the curriculum, provide additional support if needed, provide assistive devices if needed, and to assist students to learn alongside their peers. So what this all means, by the way, is that the student with a heart, condition or a heart issue is getting the same opportunity as their peers, so the playing field is being equalled so they can achieve their potential too. So that's really, really important, because what it means is that understanding that really helps conversations with the school, because it helps to frame up, expectations and provision of assistance and assistive devices if needed. So, of course, jump on to our website, contact us, and we will support families through their journey in whatever way suits them best.
Yeah, that's great. I'm really blown away by everything you've shared. There's so many things that I'm not familiar with. I'm sure I'll need to be familiar with when my son has open heart surgery again, because it will be whilst he's still at school. Just knowing that, obviously, like you said, there's standards out there. There is no safe amount of time away from school. But obviously, like you said, touching on that whole social isolation being directly linked to social anxiety, I think we've all experienced it ourselves, or had a loved one or a work colleague or a neighbour or whatever it is. And if you think about it, we've actually been seeing a lot of it in our life anyway, in aged care. Understanding that, again, that social connection, just how important it is.
Yeah, well, there's actually a movement globally now from the World Health Organization to acknowledge that, and this is really worth our audience hearing, is that social isolation is not just a sort of uncomfortable experience, but when it's chronic, it actually has, this is proved by research, it's physically unhealthy. So there's a lot of research out on that now. And I say that because our kids are already facing their own health journey as it is. We don't want to add more to that journey and weaken their health through social isolation, if that makes sense.
No, we don't want to add another layer, do we?
No, and let's state it in a positive way. For that reason, social connection is really contributing to resilience. It's really contributing to the work that medical science is doing and
Absolutely.
our healthcare system is doing to support that, to make that work better and have better outcomes. So
yeah.
I should have said when I was mentioning the, expectations and the national regulation, the one key thing and should be reviewed regularly is to have an individual education plan or an individual learning plan
yes,
for your young person. And that's shaped exactly for their needs, where they're at on their journey, which is why, each term it's good to come back to it and say, does this still work? But that individual education plan is what really is representing that regulatory offer from, our education systems and activating it into practical, as you said, let's talk about the practical ways of making this better and work. And that education plan is that practical dimension. Like, what does this look like in the classroom? What happens when, Darcy is in hospital? Should that plan be in the folder as part of the overall plan so that medical professionals are aware of those needs and can build them into, or consider them in the plan for the day?
Absolutely. And I think one of the things you're really you're talking about here, you're talking about holistic care. You're talking about a holistic approach to the whole human. So the holistic from education, social, emotional, whether it be religious or whatever it is, we're talking about that lovely wellness wheel and model and integrating it into the medical side of things too. And we see some hospitals doing it really well across Australia and some organisations across the world who have spearheaded exactly what you're talking about, is understanding how important that we're really talking about connection, aren't we? It's connection, being connected to our medical help, connected to our family, connected to our social groups and so forth.
Yeah. And we're not just here to save bodies, we've got to save hearts and minds as well. That's my summation right there, because the reason that we work so hard to bring health is because we know it's the first wealth.
Yes.
That's the start of everything. So to be able to reach your potential, to do meaningful things, to connect with people, to feel human and to feel valued, seen and heard is what it's all about for all of us. So why should it be any different for kids?
That's, very well said, Megan, very well said, and I hear you. So, Megan, to wrap things up, we've covered so much about missing schools, right from obviously its inception in a lounge room, hearing your lived experience, with Darcy. And, the thing that you said that really sits with me is you started to see him lose hope. I love the fact that started a fire in your belly and went, right, if there's nothing there, I'm going to create it, along with obviously those who were in the lounge room. So I thank you for that. Can we just, before we wrap up, could we talk about the National Insights for Education Directory? Can you tell me a little bit about that? Because I think that's going to be beneficial. Once again, we don't need to break down the details of it, as in the contact details. We'll pop them in the show notes too. But can you tell me more about it? What actually is it and how is that beneficial to teachers and families?
Yeah, well, the National Insights for Education Directories, Sami, and thanks for asking about this, is something that we just started piloting in late 2023, late last year. And it comes from the understanding that each child's, particular health circumstances is not only their own journey, but is also, in a lot of these situations, there's a body of evidence around those particular health settings and situations too. And that's very complex for a school to get across with so many students, And so the idea was to be able to provide rapidly, like on-demand information from organisations like HeartKids, and you can imagine, across all these sort of different health situations, cystic fibrosis, Crohn's, asthma, diabetes, and we've seen how asthma and diabetes,
cerebral palsy, yep.
In school has, that education in schools has really changed how schools deal with those. But the idea was to bring organisations together in a way that they can share their expertise, their knowledge, their information, their understanding of their cohort, and place that in a situation where teachers and schools can get access to it rapidly. And to put this at the intersection of health and education, this database, so that even parents can access this information. So that's what it means in a practical sense. It means, a teacher has a child who's a heart kid coming in, they can jump onto the needs directory, they can look up heart, they can find HeartKids, and they can find a very straightforward synopsis that HeartKids has developed, along with all the contact details, links to websites. So, hey, now we head over to HeartKids' website, we can get more information there, we can get research there, but also to have this little sort of summary about what teachers should know immediately and consider immediately about a student in this circumstance. And so it's just getting that teacher into the ball game with it without overwhelming them. And at the same time, our engagement with organisations like HeartKids means that we're able to, like you and I have, share our knowledge, our information. And by doing so, HeartKids, again, as the example, can start to bring education more fully into its offer, and more fully be able to present the options to families who HeartKids engages with. So collectively, we're sort of building a national reference system and trying to bring, I guess, a national approach to how teachers view, a student in their class with in this health situation.
With chronic health or chronic illness or injury, as you said. Wow, Megan, there's so much to digest, and thank you so much for sharing everything. It's been incredibly insightful. And I think the thing that you've just given us, which you obviously gave to your son beautifully, is I think you've just given a whole heap of parents in the HeartKids community hope. And what I mean by that is it's just one less thing for us to worry about, because as you know, when you're facing these situations, you're trying to balance this and you're trying to balance that, and, you're trying to balance their nutrition at the same time too, as well as, have they done this today, and have they been outside today? Have they got some vitamin D as they're on this journey? So to know that you guys have come together and done so much heavy lifting and hard work, and clearly going to continue on with this advocacy about missing schools and just how important it is for that overall holistic well-being of that child or human. So Megan, thank you. Thank you very much. It's been an absolute pleasure to learn about missing schools.
It's been my pleasure. And, throw in there, we're doing peer animations to build empathy. We're building a national teacher training system with teacher peer support for each other to, attach to this National Insights for Education directory. We're going to be sharing and building a lot of research and impact, so everyone will have, some of those critical answers, the stats, the information, the evidence, and parent support group as well to do with education. And wrapping that all up in a big bow will be our work with government. We have worked so hard to build evidence. We have worked so hard to build proof. And we've now got that. And so we want to join with organisations like HeartKids and bring all of that forward. And surely all of us together can get some learn from anywhere, at least switched on in schools.
Amazing. Wonderful. Thank you. Thank you very much.
Thank you so much, Sami.
My pleasure. Sometimes this podcast talks about some heavy things. If this brings up anything for you or someone you love, it is important to reach out for support. The HeartKids helpline provides support and guidance for anyone impacted by CHD. You can call the helpline on 1800 432 785. To access more information about CHD, as well as support from HeartKids, visit the website at heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect you or your family's health.